305 killed and over 14,000 infected. The novel coronavirus scare sweeping the country as it rapidly spreads, not just in Asia, but in other parts of the world as well. How do we really protect ourselves from the virus? We have today with us Dr. Karl Henson, an infectious disease expert. Doc, good morning.
Hi, good morning.
Okay, let's talk about how quickly this virus actually spreads. Is it only through droplets, or is it something that can be airborne?
Well, the WHO recommends droplet precautions. That means that most likely the virus passes on through people through infected aerosols. So saliva that's infected or saliva that drops onto the table, you touch it and you touch your nose. But they also warn against or warn that doctors and nurses performing aerosol generating procedures. That means if you put a tube down a patient's throat or you ask the patient to submit a phlegm sample to wear specialized masks called N95. I don't think we really have it defined how this virus is passed on, but the current and most likely theory is that it's through just droplet infected secretion. So that means you really just need to stay away about 6 feet to really avoid getting infected by someone.
All right. Now, you talked about how maybe a spot of saliva might land on a table or something like that. Is it true that the virus can live on metal surfaces for hours at a time?
Right. Viruses in general cannot live very long in inanimate surfaces. But at this point, we really don't have a good idea what the behaviors are of this virus. But when we look at the behaviors of the other relatives of this virus, they don't last very long on surfaces. But it's the, a saliva that just landed and then you touch it, then that can potentially transmit the virus.
Right. So still better not to refrain from touching things.
Right, but more importantly, you need to wash your hands.
Right, frequent
either
hand
with
washing.
Frequent hand washing, either with alcohol hand rubs or with soap and water.
All right. In the absence of soap and water, is alcohol good enough? Will that kill the virus if it's on your hands?
Definitely. Alcohol, that's about 70%.
70%.
70% alcohol is good enough to kill most viruses and bacteria on your hands. In the hospital, that's really what we use more than soap and water, just because it's more convenient. And you can put it in your pocket or it's mounted to the wall.
Right, so you can take it anywhere with you, or it's in different parts of the hospital.
Yes.
Okay, let's talk about masks. People are buying up masks. They're getting sold out everywhere. How necessary are they?
All right, so they're very, very necessary for patients who are coughing to stop the spread of these infectious droplets. For everyday work, it's really not necessary for people to wear masks, when doing their computer stuff at work or walking in the malls. The WHO has given us some guidelines on really who needs to wear masks, and these are people who care for sick people. Well, no. Number one is sick people need to wear masks,
Right,
surgical
so they don't
masks,
infect other people.
so that they don't infect other people. People who care for these sick people need to wear masks as well to protect themselves. And then healthcare workers need to wear masks. Outside of those three, it's really not necessary.
Okay, so if I'm not sick, I don't need to wear a mask.
Yes,
and if I'm
correct.
not tending to anyone who's sick or, who has corona.
Correct, yes.
All right. Now, there are a lot of places that are very full of people. I could be in a bus, a train, a jeepney. I could be in mass, in a waiting room somewhere na maraming tao. How do I protect myself in situations like that? Especially, let's say there's somebody on the train, umubo siya, wala siyang mask. What do I do?
Well, traveling, I think, is a little different in that it's closed, contained quarters, right? I wouldn't fault anyone for wearing a mask while, say, inside an airplane. But I think the better message here is that if you are sick and coughing, then it's best that you wear a mask so that you do not transmit to other people. If the people around you are not coughing, then there's really very low risk for you to get anything from them.
Okay, but in riding an airplane, you recommend wearing a mask?
Yeah, I probably would, just because it's a contained space and the air doesn't flow very well. And especially now that we're really seeing a lot of cases that, around the world, then it might be a good idea.
Okay, so in enclosed spaces where the air is being recycled, you would recommend a mask?
Right.
Right. Okay, and of course, you know, the problem with the nCoV is that it has symptoms very similar to other illnesses, especially, you know, the common flu. So if I'm having these symptoms, if I have a fever, ibig sabihin ba nun, I should go to the doctor right away? I should have myself checked at an ER?
So for this particular outbreak, the most important factor that we look at is travel history. Most of the countries outside of China do not have any forward transmission yet. That means for example, if I was sick, I got it from Wuhan, I come home, and then I transmit it to you, who was never in China. That has not really happened a lot. So we still look at travel history and exposure history as the main thing when considering whether a patient likely has 2019 nCoV. So there are a lot of viruses and actually a lot of even bacteria that will cause fever and cough and shortness of breath. But we start considering patients as possibly having this coronavirus if they have some form of travel or contact history.
All right, so we're still looking at that.
Yes, definitely.
Okay, so if you have a travel history, then do get checked out.
Correct.
Okay, now the remains of those who died, the recommendation seems to be that the remains are cremated immediately. Why would that be the case?
I think it's really just because we don't know yet the behavior of the virus. I just want to use an extreme example. For example, for HIV, we no longer recommend cremation when a patient with HIV dies. That's because we know how the virus behaves, right? I think eventually when we know more about the virus, there's going to be some point where we're going to stop recommending cremation. But at this point, I don't think we really know enough about it.
Okay, so at this point, we don't know enough. So just rather, you know, to be safe rather than sorry, the recommendation is to cremate. But if we discover na hindi na infectious yung remains ng tao pag patay na siya, then you could do burial or other forms of.
Yeah, definitely. This virus isn't bloodborne. It's not like Ebola. For Ebola, definitely there has to be like immediate cremation, and because the secretions and the body fluids can infect other people, but we do not expect that for this virus.
All right. Thank you so much for that and for speaking with us this morning. We do appreciate it. Infectious disease expert Dr. Karl Henson.